The new coronavirus is spreading in Kenya. It's being transmitted at local community level. Health officials are not sure just how far the virus has spread. They can only get a good indication once mass testing begins. The medical community is concerned that many Kenyans are underestimating this virus, that the number of reported cases is giving the country a false sense of security.
I'm so disappointed that even up to yesterday, we are still fishing men out of pubs, especially even in Eastlands, in Donholm.
The number of positive cases in Kenya currently stands at 262, considering that the Ministry of Health was anticipating 10,000 cases by the end of April. It's no wonder that people are more concerned about the economic implication of COVID-19.
Tunaumia bwana, tunaumia. Tunasema Uhuru atafute hata kakitu aturushie. Kabisa. Unapata 200 unatumia na fare inaisha. Sasa tunaumia. Atuangalie. Thank you.
These traders that we met on our drive to the hospital mentioned nothing about the coronavirus disease or health concerns that they may have. This is one reason that health workers and officials want Kenyans to see the reality of this disease.
It can cost us way above 1 million just to treat one patient.
We have been granted rare access into Kenya's ground zero for COVID-19. It's the first time that journalists and the public will see inside Mbagathi isolation wards treating patients with the coronavirus disease. In this two-part special assignment, we will hear from Kenyans who have contracted the coronavirus disease locally and get a first-hand experience of the challenges of treating an illness that the world knows so little about. This part of Mbagathi Hospital has been sealed off and dedicated as COVID-19 center. It hosts the isolation wards with a capacity of 60. It is mostly a safe area, and one only needs to wear a mask and to keep a safe distance. But when doctors, nurses, and cleaners go into the wards to see the patients, they must don their personal protective equipment. Within the compound, one man is waiting for his taxi. He has just been declared COVID-19 negative after spending a fortnight here.
Where I live, nobody traveled, so I didn't contract it at home. I had gone to Tuskys Mall to buy some fruits. That is one place I suspect. But I sanitized my hand, I kept my distance. And then when I went to the hospital at Galleria Mall, that is the Nairobi hospital, after I was discharged, I went into Carrefour to buy some fruits. And I also observed the hand sanitization and then the social distance. So between Tuskys Mall, the Galleria Mall, and then the hospital, the Nairobi hospital, which is in the Galleria Mall. So those are the three places I suspect. Yeah.
This patient showed no symptoms of COVID-19 other than a slight fever at the beginning. Doctors at Mbagathi say that most of the cases they are handling here are mild to moderate. We are being allowed to go inside the wards and to take our cameras in. It will be the first time we're interacting at close proximity with patients who are still positive with the coronavirus. It is a tightly controlled area because of how infectious this new coronavirus is. One mistake and you risk getting contaminated and possibly infected. The healthcare workers take us through the WHO required method of wearing this protective gear. These PPE kits have become a rare commodity worldwide during the COVID-19 pandemic. And so for every kit that we have used in this shoot, Royal Media Services will replace them. Today, we will join Dr. Lois Ombajo, the head of Infectious Diseases Unit at Kenyatta National Hospital, Dr. Tende, and Nurse Maggie as they make their evening rounds around the ward. Access to the ward is closely monitored. Those inside cannot leave. but some emergency exits are available.
All the best.
Once the team is in, the door is again locked from outside. This long corridor ushers us into the ward. At the entrance is a young lady. She may be in her late teens or early 20s. She's sat quietly on a plastic chair and remains mum. Patients here are allowed to walk around the wards freely. They have created some sense of community, almost like a family. In the first ward, 2 young men are seated, chatting away. One is Kenyan, the other Congolese.
They speak French, eh?
They speak Kiswahili.
These 2 are awaiting their second results. If they come back negative, they will also be leaving. It does not feel like any other hospital ward. It's hard to ignore the smell of fresh paint, the lack of heavy linen. Save for the few glimpses of patients' personal belongings, it all feels very clinical. The team has told us not to touch anything, not an item or a surface. It's possible to get particles of coronavirus in the air, but surfaces are likely to be more contaminated. The team of doctors and nurses have to be accurate with their diagnosis, empathetic to their patients, but swift. This round should not take more than half an hour. Even with your personal protective equipment, the longer you stay inside the wards, the higher your chances of being contaminated.
But the doctors have just gone into a ward where there's a patient who's coughing, and we've just given them the privacy to be able to deal with the patient and to attend to the patient, and we're waiting outside. But overall, it looks like for most of our cases, we've not got to that point where we have very many severe cases in the ICU needing ventilators. It's just a wait and see, and crossing fingers that it remains this way.
So majority are usually symptomatic, but they come with very mild symptoms. The most common being a fever. Some will have a cough. Some come when they're totally asymptomatic. They're probably tested maybe because they're in a quarantine facility or have traveled into the country recently. And when that is found as positive, the reason they're admitted here is what we call isolation, where you keep them in this unit to avoid any transmission to other members out in the public. So on average, most people will have cleared around 14 days, on average. But still we have people who shed.
Yes, I understand that. But my concern is, I don't know why I am not part of the normal. Because that's the explanation I'm seeking.
Yeah, I know. I don't think we have an answer for you on that one.
Because
Dr. Lois is having to explain this complex fact to one of her patients. The young man shows no symptoms, but tests positive for the coronavirus more than 25 days after being admitted here. A majority of the patients here want to keep their medical information private. Although many of them only have mild symptoms, the mental exhaustion from living in isolation is taking a toll on them. One of them, however, tells us he wants to speak out openly.
In this moment of uncertainty, it's only fair for some of us to come up and share with the citizens and fellow countrymen about what is happening, and that information will be useful, especially when it comes from the horse's mouth, and from people who have experienced this. I am 19 years old, and I got a scholarship in Switzerland. Well, when I traveled home, I was making effort to self-isolate, and I was feeling quite weak, and I thought I was suffering from malaria, which was later proven to be true. So I went to hospital in Bugoma. I was carried on a motorbike, and in Bugoma I was tested with malaria and it was positive. And when I go to the hospital, I did not have high fever, but just somewhere along the way my fever went high, and having shared the travel history, the doctors thought it wise to rush me to Mbagathi. Probably they consulted the ministry, and this was the most appropriate place. So I came in an ambulance all the way from Bugoma. I have been here for quite long now, 25 days, which is unusual. Most of the people I came with have already left, and many others came after me and have left. The doctors are not quite sure why this is the case, neither am I, because I'm feeling healthy and okay, but the tests keep coming positive, so I can't explain.
We follow Dr. Tende upstairs, where a new patient is just settling in.
Let me first ask them if they are comfortable. Mama.
She was brought in for testing after coming in contact with a friend at a party who had COVID-19.
Alikuwa na party nikaenda kumsaidia kupika kote. Sasa huyo ndio alipatikana na mgonjwa. Tukakaa ndio nilipigiwa simu.
Okay, ulikuwa unasikia mwili vibaya?
Nilikuwa na homa. Sasa wenye kuniuliza wakaniuliza nikaambia niko na homa lakini nilikuwa nimekunywa dawa ikaisha. Sasa ndio nikakujiwa nikaletwa huko.
Everyone who had come into contact na yeye.
Sasa wale tulikuwa na wao niwasema nini yeye pia akanisema na wale tulikuwa na wao. After na mimi nini kupatikana tena na mimi nikatoa ni wale tulikuwa tunao lakini ni hao tu.
30 minutes later, we have overstayed the required time. Dr. Lois tells us it's time to leave. It's also time for the patients to get their vitals checked and to be served their dinner. Maggie, the nurse, is finishing up with Stephen. She tries to lift up his spirits before we leave.
Are we back? That's better.
Okay.
Yeah. Next week you're doing home.
Okay, sawa. Oh, thank you. Sawa.
After exiting the wards, we must decontaminate and safely remove our personal protective gear. The process is called doffing. It is a simple routine, but must be conducted precisely, almost ritualistic. Our cameras are also properly cleaned and decontaminated. This is the risk that Kenyan health workers must take to tackle COVID-19. For some of them, they attend to these patients several times a day. Government is now recruiting more practitioners to help contain a possible influx of COVID-19 patients. They have to be properly trained for the task ahead.
Keep the social distance and wear the mask because COVID is an abnormally expensive disease. I do not know any other disease that is so expensive in terms of just kitting the health worker to be able to deal with it.
On the second part of this special assignment, we'll highlight the frontline workers. We'll learn about their daily tasks while treating COVID-19 patients and examine the critical issues that government must rush to address. Asha Mwilu on special assignment for Citizen TV. We've been granted rare access into Kenya's isolation wards for COVID-19 patients. This is Mbagathi Hospital in Nairobi. It is ground zero for COVID-19 medical response in Kenya. Once a person is suspected to have contracted the new coronavirus, they are placed in this section where they are tested, and if confirmed positive, they are moved into the isolation wards, a tightly controlled and monitored area. The health workers here prepared us to go inside the wards to get a first-hand experience of just how complex the response is for those dealing with a highly infectious disease, which has no known cure. This thing is a lot about teamwork, huh?
Yeah. Oh yeah. Even when you're joking, you're watching each other, you're reminding each other.
Only shoulders. Don't assist.
When mistakes or accidents happen, the repercussions are grave, and it could mean that essential health workers who are needed on the front line are forced to be grounded. This second part of our special assignment takes us into the shoes of our frontline responders to examine the threats that Kenya's health workers face while in the line of duty, and to examine government's preparedness to support crucial aspects of the healthcare system. This is the infectious disease unit at the Kenyatta National and Referral Hospital in Nairobi. This is where Kenya's first two COVID-19 patients, Brenda and Brian, stayed during their recovery. Dr. Samuel Njenga runs a tight ship here. His experience as an infectious disease specialist is rooted in the response to the Ebola crisis.
During that Ebola outbreak, all suspects for Ebola virus disease were managed from here. But fortunately, during that time, we never got any confirmed case of Ebola.
Dr. Njenga says he will allow us into the isolation wards, but we must follow all safety routines. Behave like health workers, he tells us. While Mbagathi Hospital hosts most of the confirmed cases from the general population, Kenyatta Hospital is taking care of health workers who have either tested positive or are suspected to have contracted the new coronavirus.
Quarantine is not for doctors. We are quarantining anybody, all healthcare workers who have been in contact. Not necessarily they are positive. The ones who are positive, I'm sure you saw them there.
At the IDU ward, we meet 54-year-old Stephen Hagai. He's a health worker, a cleaner. He contracted the virus while working at the wards at Mbagathi just a week ago. Dr. Njenga has allowed me to go into Hagai's ward for a conversation. I've donned the personal protective equipment. But the doctor wants us to keep our filming equipment at a safe distance, so our cameraman will film from outside the window.
How many days has it been on unasikiaje?
Leo ni siku ya 10. Hakuna kitu ninasikia. Sikohoi, kisimizi.
Kwa symptomatic kabisa.
Once you know you have been in contact with somebody who has tested positive, we quarantine you.
How many health workers?
I would not have the figures overhead, but we are ranging now around 40, 50, around there. Because some of them are mine and I am protecting them. Luckily, we have also tested them now. They are all negative. Now we are waiting for time until once we clear them, the 14th day, they come back to work.
The latest situational report by the World Health Organization says that as of 8th of April, more than 22,000 COVID-19 infections were reported among health workers in 54 countries worldwide. With more than 50 Kenyan health workers in quarantine or isolation, government must now act fast to address the possible gaps. The first is to work on the numbers.
The numbers of healthcare workers that are going to be needed for this response are phenomenal. For sure, we've always had a gap. We've never had enough healthcare workers, and it's never been more apparent than now when we realize that sometimes if you're going to have healthcare workers who may be exposed and may have to be exited to quarantine because they have been exposed, then you need healthcare workers.
The state wants to hire an additional 8,000 healthcare workers to be deployed across the country for the COVID-19 response.
Under the universal health coverage, we had already started the process of recruiting over 8,000 workers, different cadres, for all the counties in the country. We had also, under the same universal health coverage, begun, and actually some counties have deployed 4,000 interns. And in addition to that, now for COVID, we've only had to invest an additional 1 billion, which will go towards recruiting the more specialized health workers for the ICUs, for theater.
If Kenya is able to boost the numbers within the next few weeks, another big task will also be staring at government: training.
We have to make sure that even right from the lowest level, because not everyone is going to come to a high facility such as where we are, they are going to start from the lowest of facilities. So how the healthcare workers should be able to identify what are the signs, what are the, what is at high risk for a COVID worker.
The Health Ministry says they have partnered with medical professional bodies in the country to train healthcare workers on how to use protective kits and how to follow required protocol when handling COVID-19 patients. This training will have to be done virtually. But as we have learnt during our time with the teams in the 2 hospitals, wearing and removing this protective equipment is no walk in the park. In the beginning, we first observed Dr. Njenga and Nurse Angeline as they went through the process. They have a buddy system where they check on each other to ensure that they have worn the gear correctly. And then it was our turn. The recommended practice is that you have someone supervise you as you wear the PPE. Ruth, the head nurse, will be my supervisor for the day. This process is called donning. First step is to sanitize correctly. Wear the boots, then the coveralls, the hairnet, and then the first pair of gloves, which will be the tightest layer of protection for my hands. And then it's the N95 mask, and then the goggles. An apron is then added on top of the coveralls, and then a second pair of gloves. At this point, it's almost impossible to identify the person under the gear, and so the head nurse writes your name and your designation.
By writing your name, you are humanizing yourself. You are also explaining what you are likely to be doing in her space.
On the arm, the time that you're entering the wards is noted. Everything is documented to ensure accountability. When inside the patient's area, you're encouraged to avoid touching surfaces or items. However, it's common that a health worker would need to touch the patient or to clean up bodily fluids. They would in such cases be required to remove the outer gloves, sanitize, and then wear a fresh pair of gloves.
On a morning, you may have like minimum 6 people going to the patient area. They have to wear full PPE. And some of these activities are repeated in the course of the day. The nurses will go in the morning, they'll go back before midday, and they'll be back in the afternoon and in the evening and at night. So if you look at the nursing staff working with 2 nurses going to the patient side, and they are going there like 4 times a day, you're already using 8 PPEs.
Of course, it's challenging. One, it's challenging. 2, somehow it is like I say traumatizing, but we go a lot of support, psychological support, which is done.
Wearing the PPE is perhaps the easiest part of this process. Removing it, or what they call doffing, is much harder. We are told this is where most health workers contaminate themselves and get infected. And so in their training manual, government will have to focus on this process before they can deploy the new healthcare workers to deal with COVID-19 patients. We could already see how difficult it was for our colleagues from the Nation newspaper to remove their PPE. Now, it's our turn.
Not near, they are up. Up on the yes, good. Cut.
Dr. Njenga and Nurse Angeline supervise my every move.
Sanitize.
At last, we are out of our contaminated suits, and the last step is to wash our hands thoroughly with soap. We can't help but wonder just how effective the training on this crucial process will be for health workers across the country, especially if it's all done virtually. Our equipment has been thoroughly sanitized and decontaminated. For all the PPE that we have used during our filming, Citizen TV will be replacing them. As we leave the hospital, we go through another set of precautionary measures from our Royal Media Services COVID-19 team. Handling the coronavirus disease has been the test of times for healthcare systems across the world. Economies with much superior systems have crumbled when the number of patients overweighed the capacity of their systems. For Kenya, the experience in dealing with infectious diseases may be an added advantage. But with issues like recruitment and training yet to be finalized, officials can only hope that an influx of patients is not around the corner. Asha Mwilu, on special assignment for Citizen TV.